Good afternoon to all viewers. We are going live right now. So a very good afternoon to all colleagues and friends. Thank you for spending your afternoon with us, your Saturday afternoon with us. This is a Health Talk series, a community service effort by Rotary Club Kuching and 20dB Therapy Tree to create an awareness about health and healthcare. We had a session last week about mental health. So if you have missed that, you can watch the replay of it. And today we're going to talk about speech therapy for adults and geriatrics. But before we get into that, I'd like to first invite Rotarian Chiu Tek Seng, the club secretary for Rotary Club year 2020-21 and president-elect for next Rotary year 2021 to 2022. So, Mr. Chu, could you come on here? Yeah. Welcome, Mr. Chu.
Hi, thanks, Madeline. Hi, everyone. Good afternoon to all the ladies and gentlemen and for the audience over the internet virtually. It's really a good pleasure and honor to be invited to represent our club, Rotary Club of Kuching Unity City, together with our Rotary partner of the day, 20dB Therapy Tree, to have this joint event this lovely Saturday afternoon. Just to have a quick so-called a brief background of Rotary. In Rotary, what we are actually looking at is the sustainability as well as the continuous effort. So to give you some background of the Rotary, as of 30th of November 2020, we have about 4,173 members in both Malaysia, Singapore, and Brunei, which is under the district of D3300 and D3310. And worldwide itself, we are actually reaching about 1.2 million members. So that itself is basically seeing really a global presence with the local connections. So along these years, Rotary, as well as all the Rotarians around the world, we actually work together to focus in 7 areas of the focus. To name a few, disease prevention, okay, providing clean water, sanitation and hygiene, serving mothers and also the children. Of course, since we are talking about the virtual health event today, just to also let you know a bit about a very big project that Rotarian has been working for over 35 years ago, which is the End Polio Now. So up to recent years, actually all the Rotarians in the world, we have been working together with the foundations to eradicate the End Polio. So we have reached about 99.9% eradication up to date. All right. Of course, during this pandemic with the COVID-19, everyone is also a bit stressed. That's why over the last week, as well as the upcoming week, you will be actually seeing the series of this so-called the health talk will be running continuously. So we have the mental health last week, and today we are going to talk about the speech therapy, which is something quite unique and something quite new to many of us as well. So just to look into this as a more holistic and as a Rotarian together with our Rotary partner, we hope we can actually work together to address the health issue from every angle. Okay, so just for the last part, just to bring to your knowledge as well. In fact, okay, before the pandemic this year, in 2018 and 2019, our club, Rotary Club of Kuching DCT, together with some of the local partners such as 20DB, Kwan Ho Leong, some of the doctors, we had actually conducted a series of the comprehensive health program physically as well. We actually went to places like Pau, Kota Samarahan, or even in Kuching itself to basically give the comprehensive health screening to our sandwich community. So hopefully with today's session, when we are trying to actually put this in a virtual event, we hope the audience, the ladies and gentlemen who are sitting in front of the session right now, okay, help us to actually share this session to your circle of friends, to your networks, so that more and more people will be benefit from this. And last but not least, I hope all of you will enjoy the speech therapy for adults and geriatric population today. Okay, now back to you. Thanks.
Thank you, Mr. Chiu. It is indeed such a pleasure to be able to partner with Rotary Club Kuching. And, we would like to encourage participation from the community leaders, partners, and volunteers to contribute their knowledge, expertise, and resources for the good of the community. So, yeah, thank you, Mr. Chiu, and thank you, Rotary Club. Okay, so today we are going to talk about speech language therapy for adults and geriatrics. It is my great pleasure to introduce to you Millie. I'm going to put Millie on screen here. Let me just introduce Millie to you before I hand over the time. Millie is a speech and language therapist who specializes in adult rehab. So Millie is Kuching Lang, okay, born and bred in Kuching. But she continued her studies in the US and she graduated with a bachelor's in psychology and arts and holds a master's in science. And she's also a certified speech language therapist with a certificate of clinical competence by the American Association of Speech Language and Hearing. And she's also the only speech therapist with LSVT Loud certification, which you will hear about it later during the session. And Millie has worked for 6 years in a level 1 trauma hospital in the US. And she again specializes in communication and swallowing treatment in adults and geriatrics. So welcome, Millie. Thank you for joining us.
Hi, it's a pleasure. Thank you so much for having me to give this, a little bit of a speech about what we do as a speech therapist for the adult and geriatric population. So thanks, Meg.
Yeah, Millie, you came back this year? You came back this year, right?
Yeah, we actually touched down 2 weeks before the MCO started in March. So I've been here from the very beginning with you guys suffering through all the MCO. So
it must have been quite a time of adapting to a new environment and a new working environment as well. So
yeah,
Millie,
yeah.
So we're really thankful that you're back, so we can up the level of speech and language therapy services for adults and geriatrics. So viewers, if you have any questions along the way, please feel free, or comments, please feel free to text in the chat box, and we will try to attend to those questions as best we can. Okay, so Millie, I often have people come up to me and so you're a speech therapist. What do you teach people how to talk, is it? So we get that question quite a lot for us speechies. How would you respond to that?
For sure, that is by far one of the most asked questions I get from my patients, my clients, whenever I introduce myself. And, I always like to tell them that in a very, very broad sense, yes, I do teach people how to talk, but the scope of our practice is much more than just that. And the field of speech therapists is continually growing every day. And according to the American Speech Language Hearing Association, or you'll hear people call them ASHA, speech language pathologists, they work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in the children and adult population. And if you want to break down the different field that our speech therapists will work with, they they fall into these 9 major categories. You have speech, you have language, hearing, swallowing, cognition, voice, social pragmatics, fluency, and AAC. And AAC stands for Augmentative Alternative Communication. We'll talk about that a little bit later on towards the end. So don't fret if you haven't heard of the term AAC before. We'll go over a little bit more later.
Millie, about this nine categories, do all speech therapists, do we treat, I mean, a patient with, do we specialize in all those nine categories or?
Uh, a speech therapist most certainly can, and I've known people who kind of have their foot in all 9 categories. But for most of the speech therapists, because each of those categories, you have to specialize in them in order to be up to date with all the research. So a lot of the speech therapists I know actually will select a few from the 9 categories and specialize in them. But it is certainly within a speech therapist's scope of practice to see all 9 under for themselves, to see all 9 at once. Yeah.
Okay. So, yeah, so speech therapy encompasses, children and adults. Would you like to elaborate that a little bit more? And who are we talking about when we mention adults or geriatrics?
Yeah. So while both pediatric and adult speech therapists, they are both professionals in the field of communication and swallowing treatments, but there are distinct differences in how a pediatric speech therapist versus an adult speech therapist may approach their clients or their patients. So oftentimes in the pediatric population, there's a heavy focus on what we call habilitation. Well, it's not solely just that, but there's a larger focus. And habilitation is the process where the therapist help the kids to develop skills that they have not yet mastered. Okay. But on the other hand, for the adult and geriatric population, we focus a lot on the rehabilitation portion, which means that we aim to help the individual to regain skills, abilities, or knowledge that they used to have but have lost them due to illnesses or accidents. So because of this fundamental differences, the way the speech therapists are approaching their clients in the pediatric world versus the adult slash geriatric world is going to be somewhat different. And earlier on, Meg, you were asking about, adult geriatric, why are we so adamant about mentioning the two of them? So even though they are oftentimes being grouped as one, within the medical field, there's a further need to differentiate in how they're categorized. So for my practice, I usually would consider anyone above the age of 18 as being an adult, as usually once people get to that age, they are done with their cognitive development. as far as the geriatric population goes, sometimes there's some variables in terms of how the practitioner may classify someone as being geriatric or not. For my personal practice, I would consider someone above the age of 70 years old as being within the geriatric population. But I have heard of some other practitioner who may consider anyone above the age of 60 as being the cutoff point. The reason why it's important to differentiate the adult versus the geriatric population, because our brain goes through different changes as we age. So when someone is 18 years old versus when they are 78 years old, we want to approach therapy differently. So that's the reason why I would separate the adult versus geriatric population, just to give people an idea that the need to have a distinct approach in how you approach them. So within the adult and geriatric population, some of the most common conditions that I've seen are individuals with stroke, 中风, okay, traumatic brain injuries, 脑创伤, brain tumor, 脑瘤, Parkinson's disease, 柏金森症, head and neck cancer, 头颈癌, spinal cord injuries, 脊髓损伤, vocal cord injuries, 声带损伤, dementia, 老年痴呆症, and also other neurogenic disorders, 其他神经性疾病. Of course, there's certainly other rare diseases that I've come across throughout my 6 years of being a speech therapist, but I don't want to bog you down too much by going through all of them, so I'll keep the list nice and short. So going into each of the different categories, you might have heard or may be familiar with the different conditions that I had mentioned in the previous post, but sometimes it can still be hard to get a clear understanding of what a speech therapist does without further context. So I want to take a little bit of time to just explore these symptoms and how a speech therapist can come and play in the individual's recovery. Okay, so first off, let's talk about brain injuries. When we talk about brain injuries, it can include stroke, brain tumor, concussion, or brain injuries, traumatic brain injuries from a car accident or a fall. All that we will lump into the brain injury category. The one important thing to know about brain injury is that when you have an injury in the left side of your brain, it's going to present itself very differently than when you have a brain injury on the right side of your brain. For example, for someone who had left-sided stroke, oftentimes they might have more of a language challenges, while someone with a right-sided stroke might have more what we call the cognitive processing challenges. It's also common for someone with brain injury to have speech and swallowing challenges as well. So digging further into what those are. So when we talk about speech issues, we are oftentimes referring to someone who slurred their speech, or when they speak, they can't speak as smoothly as they used to. And in terms of language challenges, it could include someone if they have trouble saying the right words they want to say. They know what they want to say, but they just can't seem to get the word out. Or you might have experienced this tip of the tongue symptom. It's where you feel like the word is just right there, it's on the tip of your tongue, and then it just won't come out. Sometimes, especially if you've had injuries to the left side of your brain, that's an indication that you might have some language processing issue. Or language challenges can also include if someone have a hard time understanding or comprehending what other people are telling them. Or they could even have trouble writing things down. When we talk about cognitive challenges, we think about inattention, someone who seems very, very distracted, more so than they used to. If they have memory loss, they have trouble problem solving even the most simple activities like how does one get dressed? How do you get from your house to an appointment? All that, trying to find your way to get to your appointment. Sometimes the person might even have trouble getting started with an activity. And people don't think about this portion a lot, but with brain injury, sometimes it also makes it hard for the person to regulate their emotions. So if we talk about someone, say they got into a car accident, they had a concussion, they can't remember things very well. On top of that, they just seem to get really angry or frustrated very easily. Those are part of the cognitive challenges that one might have after a brain injury.
Right. If I could just pause a little moment here and share a personal story about that. As I was listening to you, Billy, about speaking about the symptoms and all these challenges that the person with brain injury suffers, it reminds me of my mom. My mom had a stroke 20 years ago. And at that time, I was only in first year uni, know nothing much about speech therapy. And I came back to see my mom, who just had a right-sided stroke with left-sided weakness, and I know she could recognize me because there were tears in her eyes, and she knows it's me, and she gave me a hug, but she just couldn't call me. She just couldn't say what she wants to say. She just went and it was so hard for her, so frustrating, and in a lot of sense, she was like as if she was grieving, like she cannot express herself well, and I also remember that I know my family and I, we were also pretty stressed out. Apart from her not being able to walk or feed herself, she just couldn't. She had so much to tell us, but she couldn't, and it was very frustrating. And this is an ongoing challenge. And I think for us at that time, it would have been very helpful if we had. That time I was only first year, so I just did whatever that I learned from first year. But it would be really helpful for us to have a speech therapist work alongside and walk us, the family and the patient, together through that difficult time. And so many questions like, how do you talk to her? How do you make her understand? So yeah, if you could elaborate, what can a speech therapist do in this situation?
Yeah, and I'm sure Meg's story really resonate with a lot of people who knows, either themselves or their friends and family has gone through similar experience with a stroke. So what can a speech therapist do? And SLP, you might hear me kind of go from saying SLP versus speech therapist. They're both interchangeable in terms of their names. Sometimes it's just easier to put SLP. It just means speech language pathologist. Anyways, what can an SLP do in brain injury? So first of all, we want to first determine the level of speech, language, and cognitive difficulties. We need to figure out exactly what this person can or cannot do. And then after we know what their levels of difficulties are, then we will want to provide the appropriate evidence-based treatment plans, including sometimes compensatory strategies. And the reason why I highlighted evidence-based treatment is I want people to know that the field of speech therapy, it's a scientific field, okay? We do things, we try to administer treatment plans that have been researched by our other colleagues or other professors. So we're not just pulling things out of thin air, and it's important to have that distinction that we are a scientific field, and a lot of what we do are evidence-based. So compensatory strategies refers to, say, someone has only mild difficulties, they just need a little bit of help to kind of figure out what are some of the ways that I can overcome my difficulties, either through using a planner if they are very forgetful, showing them ways to effectively use a planner to help them remember things, so we can help establish that compensatory strategies. And then the next part, and it's really the key of a lot of the work that I do with my client, is to provide education to caregivers. And the reason that I focus so much on that is because communication does not happen in a vacuum. We don't communicate with just within our own body. In order for a communication to happen, we need to have someone else to communicate with. And a lot of times there needs to be an understanding from the communication partner in terms of making sure that the environment is set up appropriately to have a successful communication with the person who had the stroke or brain injury. So providing education to caregivers is very, very crucial in my line of work. Um, and if, for example, spoken language is no longer an effective way for the person to communicate, then we will try to establish a different way to communicate, an alternative communication tool if that is needed. That's what we will work together with the family and the individual with the difficulty to establish a system that will work for them. And then if they have swallowing difficulties, then we will help them determine what the safest diet texture can be, and if they are appropriate for any exercises or strategies so that they can continue to eat and drink, but in a safe way so that they don't risk choking or having lung issues.
Right, Millie, I see that in a lot of cases, happening around, there are patients who, have had brain injury or stroke or neurological problems that causes speech language difficulties, and other difficulties. The patient usually gets consistent physiotherapy, occupational therapy in his rehab process, but oftentimes the speech, the communication part, the language part is being not emphasized, or irregular therapy, or no therapy at all. So how is that?
I think one of the key reasons for that is because communication disorders or challenges is such a silent disease. We oftentimes have people who are so brain injured, but then they can walk around fine, and as long as they don't try to communicate, you cannot see their communication breakdowns. And so oftentimes we will refer to these individuals as the walking wounded, the walking wounded in the sense that they can walk around, people look at them and say, oh, they're fine, nothing's wrong with them, but they don't really know what challenges they're having internally that is preventing them from having that communication or connection with others. So it's not communication breakdowns oftentimes are more silent. Unless someone actively tries to show it, it oftentimes goes unnoticed.
And also, I think, we're really glad that we have speech language therapy services now in Malaysia compared to 20 years ago with my mom. And, although there are not many of us, I think in Kuching itself, we have less than 10 only. And for a hospital with 600 plus beds, we only have 3 at the moment, or is it 4? Yeah, so
Wow.
yeah, so it's really good to see. We hope to see that this field will continue to grow and be able to provide a more comprehensive and regular, consistent treatment to our patients. Yeah, okay.
Yeah. Yeah. And part of it too is the awareness, I think, within the Malaysian culture is the awareness for the rehab in general is slowly growing, but the awareness for speech therapists is still a little bit lagging behind. So this is why we're doing this talk, is to give awareness to people, saying that these are the conditions. If you're having these trouble, you can go look for a speech therapist for help. Yeah. So moving on. So that is kind of a conclusion for the brain injured individuals. So for Parkinson's disease, this is a picture of a famous American actor, Michael J. Fox, who is probably one of the most famous person with Parkinson's disease. He is actually the main actor in the movie Back to the Future. You know, in that movie, they're Back to the Future into the year 2020, and here we are, 2020, talking about Parkinson with Michael J. Fox. So when someone has Parkinson's disease, they oftentimes they start to have softer voice, and it's so soft that other people have difficulty understanding them. And it kind of goes down gradually. You know, that is not their normal voice, and then slowly their voice over time just gets softer and softer and softer. Or sometimes they might even have stuttering like speech pattern, or they just speak so fast, it's almost like they're cramming all their words into one really short breath, so that it seems like they're always in a hurry. Um, or sometimes some people will also have poor cognition, like they can't remember things very well, they have trouble paying attention, or they might even have trouble problem solving their day-to-day activities. So these are the common issues that we see for individual with Parkinson's disease. So what can we do as speech therapists for this population? So one of the things is I always get the question that, you know, Parkinson's disease, there's no cure. What's the point? Yes, Parkinson's disease is a neurodegenerative disease, which means that currently there's no known cure for it, and it will just progressively get worse. But that doesn't mean that has to be the end of it, because by being active and actively managing the symptoms, we can still improve the individual's quality of life. There's a lot of research. So Lee Silverman Voice Therapy, or LSVT Loud, is one of the most heavily researched treatment program and has been shown to be effective in improving communication for people with Parkinson's disease. So a certified speech therapist can definitely offer this to help with the individual. Or we can help establish other compensatory strategies. For example, using what we call a pacing board. If their problem is that they speak too fast, then we would come up with a strategy to maybe help slow them down using a pacing board, things like that. And again, providing education to caregivers. What can the caregivers or the friends and family do to help this person communicate more effectively? And if they need an alternative communication system, we'll help them figure out what that is for them. And then again, if they have swallowing issues, same thing, we'll help determine the safest texture, recommend swallowing strategies, and we will recommend exercises if it's needed to help improve their swallowing or maintain their swallowing function. So next up, we will spend a little bit of time talking about head and neck cancer awareness. So far, you might notice that our slides tends to be a little bit wordy. It's that way on purpose so that later on, if there's a specific issue you want to revisit later, you can look at the video again to find the slides that you need, and there's the bulleted point instead of, you know, listening to my speech again. But for the head and neck cancer population, they oftentimes have varying degree of side effects, either from the surgery or radiation. As important as the surgeries and radiations are for the individual survival, we also have to take into consideration those sometimes do come with side effects, and we really want to be proactive in managing them. Swallowing difficulties, their swallowing muscles getting weaker, them having voice changes, that results in hoarseness in their voice or other type of changes in their voice, they're all common in individuals with head and neck cancers. Sometimes it can also lead to changes in their memory and their ability to problem solve. Um, yeah. And again, what can we do as speech therapists for this population? I want to emphasize that it is very important that we are proactive in managing the head and neck cancer population. And this will include gathering baseline information about their swallowing abilities, their voice quality before surgery, before radiation, and if they have extensive surgery that will be carried out, it is very important that they are given education about what the expectations are from a communication standpoint. For example, whether or not they're going to have the whole or only just a part of their tongue or voice box removed. We want to take that into consideration and really plan ahead. After the surgery or during or post radiation treatment, once the surgeons say that the individual is safe for some food and drinks, then we can also help them determine what the safest bed texture could be and provide them with swallowing strategies and exercises as needed. And we also provide education on maintenance exercises to help them minimize the swallowing and voice side effects from radiation. And if they end up needing to use what we call an electrolarynx, then we would teach them how to use one. And if they end up needing an artificial airway in their neck, then we can also work with their surgeons and help with the management of that. And of course, this will highly depend on the setting that the speech therapist is working in. For example, it is more likely for this the management of the artificial airway to happen in the hospital. It's more often for it to happen in the hospital than it would be in the outpatient clinic or rehab center. In terms of spinal cord injuries, it will depend on which level of their spine that they've injured and why and how they've gotten that injury. They could sometimes have swallowing difficulties either from the injury itself or from the surgery that is required to fix their spine. The level of injury, if the level of injury is high enough in their neck, sometimes it might affect their ability to have a really productive cough. And cough is very important to help us clear and make sure that we don't get infection in our lungs. So they might have trouble with having productive cough because of the loss of function from the injury. And some people might end up needing an artificial airway in their neck because they can't breathe effectively on their own. So similar to how we would address swallowing concerns in other populations, we will also help determine the safest neck texture, provide strategies for safe eating and drinking to compensate for their injuries. We would reinforce the education for the needs for assisted cough if they no longer can produce that strong cough themselves. And again, depending on the setting that the speech therapist is working in, they can also help the doctors to help progress the weaning off the artificial airway if that is within their goal of care. So as for dementia, you may be familiar that this will cause memory loss. It could also cause difficulty problem solving, even daily activities, like paying your bills. It could be as simple as meal planning. When people have dementia, they might start having trouble problem solving those. They might even have trouble regulating their emotions. And for a certain population with dementia, they might start having trouble eating and swallowing. Just like Parkinson's disease, there's no known cure for dementia. But again, there are things that can be done to help the individual and also their family and their caregiver to have better quality of life. So we can first help determine the level of their cognitive difficulties and establish the appropriate compensatory strategies to help them manage their difficulties. And because one of the challenges with dementia is that new learning for the individual with dementia becomes more challenging, it's important that we don't forget to provide the necessary education and training to the family and the caregivers. And for severe case of dementia, the individual may start to have nutritional issues either because they get too distracted to eat or because their swallowing muscles no longer work the way they used to. So a speech therapist can then help determine the factors behind the nutritional issues and help determine the safest and most efficient diet texture for the individual and establish appropriate swallowing strategies. Say, for example, if the individual with dementia is having swallowing issues because they no longer pay attention long enough to finish a meal, then we would focus on helping them with the attention piece. If their issue is that their swallowing muscles itself are not working quite as well, then we want to consider what kind of texture can we recommend, and what kind of strategy can we recommend the caregivers use with the individual to help them eat a more filling meal.
All right, thank you, Millie. Before we get into AAC, if our viewers are interested to know more about neurological disorders and their effects, a colleague of mine this morning was texting me and said, there's this book named The Man Who Mistook His Wife for a Hat by Oliver Sacks. And if you are interested, you can get the book and read it for information. It is a collection of recounted case histories of patients suffering from a wide variety of neurological disorders. Yeah.
Yeah,
Thanks,
no
Millie.
problem.
Millie, you mentioned earlier about establishing a communicative method or using a device or a strategy to help a patient communicate more effectively. Could you elaborate that
for
a
sure,
bit
for
more?
sure. So, augmentative alternative communication, or as we most often refer to as by their acronym, the AAC, 补充性替代沟通. Okay, it is essentially a different way for the individual who are not able to use what we call the typical communication method. So a typical communication method for most people would be speaking, or it could be sign language. If they no longer can use those typical communication method, then we want to figure out how we can allow them to communicate without using speaking or sign language. So when we talk about AAC, it is hard not to think about one of the world's most famous AAC user, Stephen Hawking. Okay, he was a brilliant man who had so much to offer, but his physical body did not allow him to show the world his intelligence because he cannot communicate like you and I would. And so, through the help of very modern technology, he was able to speak his mind without actually speaking. So, in the world of AAC, the device that you see here, and right in front of him, that black box, that is his communication device. In the world of AAC, his device was probably one of the highest technology out there. He can use his eyeballs to connect to the screen. To if he were to look at certain things, the computer will detect where his eye movements are, and then help him generate the message that he wants to. But AAC is not just about the technology. The technology is great, but it's not always available. We can always establish a functional and effective AAC system, even with the lowest technological tools we have. It could just be a printed picture. It could even just be pen and paper, In fact, in all of the clients that I've had, I would always recommend starting from the most basic system and least expensive system. and work it up from there. The reason being is that not all communication system is built equally for every single person. You know, you could have the highest technology for a device, it's not going to work the same exact way for every single one person out there. So it's really important that we, as a speech therapist, try to find what the client's ability is, and also keeping in mind what resources is available for them out there in order to find that good, nice circle in the middle. What are the systems that's going to work the best for this particular client?
Yeah, Millie, do you remember the young chap that we saw about a month ago? He's in his 30s, I think, and he had a brain injury. He could not move because of an accident, right? He could not move his limbs, his legs and hands. He could only move his eyes initially voluntarily, and yet he couldn't speak, he couldn't swallow. Yet he has understanding and awareness of what's happening and what we are saying to him, as if he's locked in. And when we saw this patient, he was already 7 years post the accident, and with very minimal prior, speech therapies intervening in his treatment. And so imagine, not being able to speak and in that condition for 7 years. So I know that you have applied for funding for this young man to receive speech and language therapy, and eventually, if with more funding, that whatever resources are available, that we could, you could come up with an AAC for him. So how does this, how would his treatment look like?
So for him, it's very important that we first identify how much is he comprehending. You know, when we talk about communication, there's so many different levels of complexity. It could be as simple as understanding the yes and no versus understanding the formula for this crazy mathematical equation you're doing. So there's a different level of complexity. First, we want to hone in on exactly where his cognitive ability is, keeping in mind that this is someone who had a brain injury. So he is probably going to have some level of memory issues, attention issues, problem solving issues. So we need to get to the bottom of what are those difficulties? What do they look like? And then from there, kind of figuring out, okay, so currently without any intervention, this is what he can do. He can move his eyeball up, down, left, right. Once we get a better understanding of what his cognitive ability is, we want to see how teachable he is for maybe something more complex than that. And for him, we started out with a very simple four square, four quadrant, kind of like a empty board. We use a piece of paper like this. We cut out the middle so that the communication partner can see through what his eye selection is, and all the family is required to do right now is to give him 4 options: 1, 2, 3, 4, because we know he has very distinct eye movement for selections like that. And then once we know that that is a workable solution for him, then is it possible that we can think about expanding the selection to just more than 4? Can we make it more complicated? Can we maybe attach a head mount onto him and see if that helps with the laser pointer? Now, all these needs to be explored before we even try to recommend him using a speech generating device, because a speech generating device is very, very costly. Like a very rudimentary speech generating device could cost several thousand US dollars. So, and we also want to think about whether or not there's such devices that exists here in Malaysia, or is something that we have to outsource? So we have to think about what are some of the realistic resources available out there for this individual. Now, it would be ideal if there would be endless funding for the individual, for everyone to get everything they need. But we know that is just not the reality we are in. So we want to be smart about knowing what the resources they have and what he's able to do, and then hopefully find a nice compromising ground in the middle that will allow him to do more that he's doing right now.
Right, indeed. The resources available and even the therapists available, it's really crucial. And how the therapist works, whether you go to the home for patients like him, or and otherwise they have to transport him with ambulance to the therapy center. That's really not workable as well. So many factors. Yeah. Right.
Yeah. So ultimately, my goal, or a lot of the speech therapists goal, or I should say the goal of speech therapy in general, our goal is to help the individual regain their functions whenever realistically possible. Knowing that it's not always possible for the individual to regain 100% of their skills. So if it's not possible, then our next level goal would be aim to achieve as much quality of life as their conditions allowed.
All right. Thank you, Millie, for this informative sharing. We're going to have a few minutes of Q&A. I think I have a few questions here. One of it is from Raymond. Raymond says, oh, so sorry. This one. In order to have good voice projection or projection quality, is it true that we should avoid spicy food as well as oily food?
If we're talking about performance level, like if you are a singer, that would probably be a very good question for a speech therapist who specializes in, training people to sing. The one reason I can think of that people would even say avoiding those food is because of acid reflux. When you have acid reflux, it might cause some issue for your voice box. So I think that's probably one of the reasons why that belief comes about. If you have too much spicy food or oily food, it might cause some reflux issue that then can impact your voice quality.
All right. Okay, so another question we have here is, do late talkers require speech therapy, especially in their mother tongue language? And is a new language a barrier for many late talkers as well? I think this person is referring to pediatrics.
Yeah, in that case, I will hand that over to Meg to answer, actually.
Yeah, I think if it's a late talker, yes. Speech therapy can help. We can educate parents and also teach parents strategies on how to help their child learn how to speak. And also, speech therapy is required. Let's see if we have any. Before I post up another question, there is another question, that it is common that people usually ask: when should a patient who has suffered a stroke see a speech therapist? How soon after the stroke?
As soon as they are medically stable, I would say. When I used to work in the hospital, sometimes as soon as the doctor deemed them medically stable, as in they don't at lower risk for any further complication condition, we would see them the same day and get therapy started. And for any source of brain injury, it's very crucial that you start speech therapy as soon as possible so you can capitalize on the spontaneous recovery portion of things and really just get in there and start giving the education to the family and the caregiver.
Yeah, and talking about spontaneous recovery, we know that a recovery after a brain injury, 3 to 6 months is the fastest within this period of time. What about if somebody who has, had a stroke, say 2 years already, and past 6 months, will speech therapy still help?
Definitely. Our brain is such a magical and amazing thing that even I've had clients who are 7, 8 years past their stroke and they've never seen a speech therapist before and it's just now getting started, they can still make progress. The only thing I would always tell people, and that this goes back to the previous questions and why I tell people to get speech therapy as soon as possible, is because, like Madeline was saying, that you get the most amount of recovery during that first 6 months to 1 year period. But that doesn't mean that the recovery ends right there. You know, your recovery is going to be ongoing, but it's just going to be slower in smaller increments.
Right. It's never too late to get speech therapy intervention for someone. What about this common question, can taking supplements cure a person's speech function? I have people who come to tell me, I've got this product and it will, you take it, you'll be able to speak in X number of months.
Yeah. Short answer, no. If the individual don't actually put in the work to do speech therapy to help stimulate the language processing or the speech or whatever part of the brain that is injured, taking a supplement alone is not going to help. So as far as I'm aware, currently there is no supplements or medication in the market that is a substitution for speech therapy.
Right. We do have a question from Elaine. What are the AAC or communication methods usually recommended for elderly with dementia?
Mm-hmm. First off, it will depend on what they are able to do. If they are still able to read, if they are able to write, we can use written words, have a pre-established board of everyday common items, writing it down so they can read. If they no longer can read or recognize words, or they don't know how to read at baseline, then you can consider doing one of those, like early on we show a picture, a piece of paper that has pictures of the common items that they may need, or even actual photos. It could be like a photo album of places they've gone to, photo albums of loved ones, so that they may not be able to say their name, but they can recognize the photo. So it really, there's a whole range of stuff that can be used. It will just really depend on where they're at.
All right, and we have one last question from Regal. How long is speech language therapy needed generally?
That is the $1,000,000 question. It's really hard to say because, again, the brain is so magical. Every brain is so individual to the person that it's hard to prescribe an actual number that works for everyone. Um, Sometimes what I can say is this is what speech therapy could look like. Say someone who just had a stroke last week and then they're starting speech therapy this week, and then it could be they have speech therapy twice to 3 times a week for the next month, and then after that you go to once a week, and then after that maybe try that for 4 to 5 months, and then after that they seem to be starting to plateau or like not making as big of a recovery curve as we want to, then you can scale it back to maybe follow up once every 2 weeks or once a month. I've had people who even do like once every 6 months, just a polish up session or just to check in and make sure things are still going okay. So there's really not a even generally, it's really hard to prescribe how many sessions before the person feels like, okay, that's a good level of communication I've gotten to. I'm satisfied with this. That's it. It's really hard to get to a solid number.
Lots of factors to consider.
Yeah.
All right. So this is we've come to the end of our session due to time. But if you have any questions, you can continue to just ask it, and we will try our best to answer them at a later time. But first I'd like to just thank Millie for this wonderful almost an hour session. It is very informative, and I'm so happy to have Millie in Kuching to give support and intervention for our patients or people who need them. So I hope you have found this really informative and helpful. If you have questions, you can contact 20BB at this number. And if you have any questions and you want to keep in touch with Rotary Club, you can contact this number on the screen. And next week, we will be having another live session on the hearing part of it, hearing assessment and frequently asked questions for audiologists. Please tune in. And so thank you for your time again. Thank you so much, Millie.
Thank you, everyone. It's an honor.
Have a pleasant weekend. God bless. Goodbye.
Bye.